Hey kids, it's Dr. B. Today we're going to start a new segment that we call Common Complaints.
Common. These are the mistakes that are common. Yeah.
All right, so we're still working on the music. Don't blame me for that. But let's talk about one of those very common complaints that we get all the time, and that is, I found a lump in my perfectly healthy child's neck. Now, obviously, when you find a lump, everyone thinks, oh, it's got to be cancer. I'll tell you, I've done this job for 30 years, and I hear I found a lump in my perfectly healthy child's neck about twice a month. And only once in all that time did it turn out to be cancer. That's one in maybe 700 to 1,000 times I've heard this complaint. So let's talk about what's much more likely to be the problem and how to tell the difference. Most likely possibility for this common neck complaint is just an enlarged lymph node. Now, I don't mean to sound disappointed. It's good that it's usually not cancer, but what are lymph nodes and why do they poke out sometimes? Lymph nodes are little bean-shaped lumps under the skin that are part of the normal immune system. They act like a filter to help the body find viruses and bacteria, and they house white blood cells, which are the cells that fight infection. Lymph nodes are all over the body. In fact, if you could remove all the skin, muscles, organs from someone, you'd be left with a little outline of a person in lymph nodes. That's how many there are. In kids, lymph node bumps are right under the skin. They're very easy to feel, especially in the neck. And when a child gets sick, they may swell up. And that's just the child fighting off an infection. That enlargement can take days, weeks, months, or even years to go away, even after the infection has been killed off. That's because the immune system remembers that there was an infection and is waiting for it to happen again. But I think that's what freaks people out, is that these lumps can stay there for years without changing. Depending on where these nodes are, they guard different areas of the body, so they can give us a clue as to where the problem might lie. For example, swollen nodes around the ear may mean the child has or has recently had a scalp infection. And swollen nodes under the jawline or in the neck may mean the child has recently had a throat infection. If there's an active infection going on, like strep throat, the lymph node is often tender. So they can be very helpful in diagnosing an illness. They may give us a clue as to where to look for an infection. So this is why you'll see me feeling around your child's neck during both well and sick visit exams. I'm looking for lymph nodes. But remember, these lymph nodes can stay swollen for a long time, even after the infection is gone. So if you bring in a perfectly healthy kid with just a lump in the neck, it's probably from an old infection and very unlikely to be from cancer. So let's compare benign neck lumps with cancer so we can all tell the difference. Healthy lymph node lumps, when you feel them, are usually small, pea or bean size, and they often grow and shrink. Cancers start out small, but they get larger and never shrink. Healthy nodes are smooth, round, and rubbery. They feel like the tip of your nose. Cancers, on the other hand, are usually lumpy and hard. Remember I said I saw that one lump that turned out to be cancer? It was lumpy and hard, and it was obvious right away that this was no simple, smooth, round, rubbery lymph node. Lymph nodes can also be slid from side to side, whereas cancers, including the one I found, are adherent. They feel stuck and attached to the surrounding tissue. And finally, a healthy lymph node will probably be tender if the child's fighting off an infection in the sinuses or the throat. Sometimes the node can be very tender because the lymph node itself has an infection inside it that needs to be addressed with antibiotics. But that's not a cancer. A lump from cancer is painless. It's not tender. Now, this chart is an oversimplification, but these are some good rules of thumb to tell these apart. What about timing? What if the lump is there a long time? What if your child has a smooth, rubbery, round lump in their neck for a couple years and is otherwise healthy? It's very, very unlikely to be something dangerous. As I always say, it's hard to have something deadly for a long time without showing signs of illness. Now, that being said, a good pediatrician should want to see any lump that you're concerned about of any age, anywhere, with any symptoms at any time. I just want to make sure that people don't panic when they feel a lump because it's probably just from an old infection. Still, if you have concerns, please bring them up with your pediatrician because we don't want to miss anything. This is a very serious issue. Well, I hope you enjoyed today's lecture. We're using a green screen now, which is pretty cool. We'll have more of these common complaints in the future. Remember, we put out a new video every Sunday at noon. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.